Hello everyone. Hello participants. Hope my voice is audible to all. Hello Akshay, Amit, Divya. Hi Khushbu. If my voice is clear and my screen is visible to all of you, kindly write in the chat box so that we can start our workshop.
Yes,
Very good evening,
all clear.
Shimani. It's clear. Thank you. Thank you, ma'am. It's visible. Thank you, Shanvi. So, as you all know, why we gather here for this such a wonderful workshop on hospital and healthcare management with our today's trainer named Mrs. Garima Tripathi. She is expert in healthcare management, and we will discuss these following points of discussion you can see on the screen. Before moving ahead, I would like to tell you that this workshop brought to you by Isaac Learn. And if this is brought to you by Isaac Learn, then we should know a bit about it, right? So for that reason, I'm going to play a video of Isaac Learn where you will get a bit more about the Isaac Learn. So here it is. I'm going to play it. Okay, so as you all have seen that what is Isaac Learn? Basically, it is just e-learning platform where you will go through where you can choose your preferred trending course, whatever you want to do to make your career. Like we have trending courses or on-demand courses like digital marketing, cyber security, data science. We do have foreign languages. We have internships, which all are virtual internships. So if you want to save your time and you want to have flexible learning, then yeah, this is the right platform where you can do with a like minimum amount where your pocket will not uh, hamper. So this is about Isaac Learn. Now let's move ahead. Before that, I would like to tell you that throughout the workshop, you people will on mute. You won't be able to unmute yourself. We will take your queries and questions at the end of this session. I'll mute one by one whosoever will have any queries and questions. So don't worry in between if you are not able to unmute yourself. You can write your queries and questions in the chat box or in Q&A session. We will take this at the end. Okay. Okay. Now moving ahead. Now I would like to introduce our trainer. Her name is Mrs. Garima Tripathi, and she has expertise over 10 years of experience in healthcare management, quality assurance, and accreditations. If we talk about, so she leads project process for NABH, NABL, etc. And if we talk about her education, she holds an MBA in healthcare services, PG diplomas in hospital management and computer application, and a BSc in biotechnology, which is like great achievements. Second, government projects if we talk about, she developed HR guidelines for medical colleges, and the mentorship she done guides healthcare professionals by combining global standards with local healthcare needs. So she has everything that you are seeking for to make your career in hospital and healthcare management. She will guide you from basic to advanced, how you can start your career in this field, how it is important, why you should do this if you are looking for. Okay, so all these things we will discuss with her now. Without any further ado, I would like to call her and I would like to request her to start the workshop. Ma'am, please start. Our participants are waiting for you.
Sure. Thank you so much, Sonam. Thank you so much for the wonderful introduction. And very good evening to all the participants. Am I audible to you?
Yes, ma'am.
Okay. Okay, just a second. I'll be sharing my screen. Okay. So is my screen visible?
Yes, yes, it is visible, ma'am.
Okay. Thank you so much for the confirmation. So before starting the session, I would request all the participants to answer a few questions. I want to understand you better so that I can revise my explanation accordingly. So, Sonam, can you please share that academic poll where we can capture the basic information related to qualification experience of the candidates?
Sure, sure, ma'am. Just allow me one moment. So here's the first poll where we want to know about your educational qualification. Kindly select the one. Okay, so as per the results, I can see here mostly, ma'am, we have postgraduate people with us.
Okay, that's great.
Yeah. Next poll is going to appear on your screen is here it is. What is your current profession or field of work? It's great to see that you all are participating in it. Okay, so basically we have maximum number of working full time. That's great.
Okay.
Next poll I'm going to shoot. Here it is. The last one. What specific outcomes do you expect from this workshop? Okay, so ma'am, there is 50-50 poll I can see. First is gaining in-depth knowledge on the topic people want to get. And the second thing, they want practical tips and strategies to implement.
Okay, understood.
Yeah, so these polls, here I'm going to end the polls.
Okay, thank you so much for participating. So, what I have understood is that you all are working professionals, highly qualified, having PG level degrees, and definitely you will want a course that is online, flexible, and easy to access. That kind of course, which will not only enhance your knowledge but also make you job ready, right? That's what I understood from poll results. So accordingly, let's move ahead with the presentation. So we are going to talk about hospital and healthcare management today. What is hospital management? What is healthcare management? So because you all are working, I assume that you must be having some experience. You must be knowing certain things about management operations. So the basic principles of management are planning, organizing, staffing, directing, and controlling. Okay. So if you have attended any management program, any certificate program in management, you must have read about this. The basic guidelines, the basic principles of general management are planning, organizing, staffing, directing, and controlling. Now let's talk about healthcare management. Same principles need to be implemented in healthcare industry as well. Okay, but it's a bit tricky. Healthcare organizations are not just like any other organization. It is a sensitive organization. It is a little bit tricky to handle the operations, the overall management. Because just to quote an example, as a hospital manager, you will have to deal with four cadres. Okay, cadre 1, cadre 2, cadre 3, cadre 4. You will have to deal with housekeeping staff. You will have to provide them training. You will have to educate them, make them aware on do's and don'ts. And you will also have to talk to specialist and super specialist surgeons. Okay. So that is the level of difference that is there when operating a healthcare facility. So anyone who wants to go for this course, that person must have a basic knowledge of clinical and medical terminology and also have a managerial aptitude. What I'm trying to say over here is that just any person having managerial aptitude, managerial skills might not be able to operate healthcare facility in a proper manner because healthcare facility management needs technical know-how of the clinical operations, of the medical operations, not the in-depth knowledge, but at least superficial knowledge. For example, if I'm saying I want an X-ray report, you should not you should not be in a situation where you don't even know the meaning of X-ray. Although this is a very simple example, X-ray all of us know. Let's consider something else. Let's say I'm saying that I want sterile sets for a particular surgery. So you must be able to understand the meaning of this sentence. What is sterile set? Why is it required for surgery? Okay, so that's what I'm trying to explain you all, that in order to manage a healthcare facility properly, not only you need to have a proper understanding of the management principles and guidelines, but also have a basic knowledge of clinical and medical operations. And that's why this subject has gained a lot of importance. Okay, the subject hospital and healthcare management. One more point. Usually people get confused between hospital and healthcare management. They start using these two terms synonymously. Let me tell you, hospital management and healthcare management, these two terms are not synonymous. They are very different. Hospital management is just about managing a hospital, a unit. That's it. Whereas healthcare management talks about public health, community health. Hospital management is just a part of healthcare management. Fine. So never use these two terms synonymously. Why I wanted to make this point clear? Because traditionally, hospital management was a concept that was limited to hospital. People used to do hospital management and usually worked as hospital managers in hospital. But now this concept is no more limited to hospital industry. Okay? Almost all industries, they have started appointing healthcare managers to take care of the health and safety aspects of the organization, of the employees who are working in the organization. For example, mines, ports, decks, textile, manufacturing, all these industries, they have healthcare safety managers. Okay. So your scope has increased, and that is a good thing. Okay. It's not that if you are doing hospital management, you will work only in hospital. You may get recruited anywhere. Okay. So this was a basic introduction. Now let's go through the description on the slide. You can keep noting down your doubts or keep posting it in the chat box or note it down somewhere. We will take all your doubts at the end of the session. Okay, so let's unveil the world of hospital and healthcare management. Very warm welcome to a comprehensive exploration of dynamic field of hospital and healthcare management. The upcoming presentation will provide a detailed overview of this essential industry, Please underline essential industry. It's no more an option now. Okay. Each and every industry needs to have healthcare safety managers. We will be covering key concepts. We will be studying about organizational structures, emerging trends, and career opportunities. Together, we'll gain valuable insights into the critical role healthcare managers play in ensuring quality care and operational efficiency within healthcare system. So that's what we are going to study today. Moving on to the next slide. Now let's understand the scope of hospital and healthcare management. So sometimes people feel, what do hospital managers do? What is exactly their role? They are not very much clear about the subject and the role and responsibilities of healthcare managers. Let us understand before going through the description on the slide. Let us understand this with the help of a hypothetical story. Suppose you are a patient, or let's consider me as a patient. I'm having some problems and I want to visit a healthcare facility. Okay. The first thing that I'm going to do is search for healthcare facilities in nearby area. For that, what will I do? I will Google. Okay. After doing a little bit of research, I'm going to get some websites, some Google listings. Fine. So the location, the healthcare facility which is nearest to me has good reviews. I will definitely go for that facility. What is this? This is digital marketing. Okay, digital marketing of healthcare facility. What I'm trying to say over here is that the role of hospital managers starts from the very first point a patient decides to visit a healthcare facility. The moment I have decided that, yes, I want to go to a clinic or a hospital, from that point itself, the role of hospital management, the role of hospital managers start. Now, digital marketing is a department which is controlled by hospital administrator. Okay, let's move on to the next step. Next, what will I do? I will either try to make an online appointment, okay, or I will call on the number that is provided on the Google listing, okay. So what is needed over here? Suppose I call and no one picked. Suppose there is no website, no way to make online appointment. I may feel a little negative about that healthcare facility, right? So what is required at this point? You should have someone to pick up the call at every point of time. Okay. For example, patient care counselors, patient care coordinators, shift wise, you can give them the same number and they should be ready to pick up the call and answer all the queries. If possible, have an online appointment system on your website. What are these things? These are IT department related things. Okay. So hospital management information system. We are talking here about hospital management information system, again under hospital administrator or hospital manager. Next, I will go to the facility. If I'm having my own conveyance, well and good. Otherwise, I'll book a cab. At this point, what I'm going to experience, how easy it was to get to your facility. So we are talking about accessibility. This is something that is decided at the very first stage of the hospital planning. The hospital or healthcare facility should be located in an area which is easily accessible to all. Okay. If I'm having a lot of problem in getting there, I may not go again. Okay. So accessibility, choosing location, planning. We are talking about these kind of things over here. Again, this is something that is done by hospital management department. As soon as I reach facility, what will I expect? Immediate consultation or as soon as possible? Minimum waiting time, or even if I have to wait, I will want a comfortable waiting area where proper seating arrangements, drinking water facility, clean washrooms, and something to read. All these kind of things are there, right? So by that, I will assess the quality of services. While I'm waiting in that area, I am consciously or unconsciously evaluating the kind of services the hospital is providing. The reception, registration counter, inquiry counter, waiting area, these are all these all create that first impression. If you get good experience at this stage, you will feel automatically feel confident about the quality of services the hospital is having. Next, I will go to the doctor. I will expect the doctor to listen to me and not just write a prescription, right? So, doctors must also be trained that you need to listen to the patient and discuss about their problems patiently. The doctor might advise a lab test, an imaging test, or some prescription drugs, or may recommend admission as well. The next thing that I'm going to do is, as per the prescription, I will either go to lab, pathology, imaging department, admission department, or pharmacy. Same thing will be applicable in these areas as well. How much I had to wait, what was the quality of service, and how well the people in that department interacted with me. Okay. All these things, the things that I have mentioned just now, come under the domain of hospital management. Hospital manager is responsible for taking care of all these things. Fine. So this was just an example. We are just discussing it on a very superficial level. Similarly, at several other points, hospital managers have a key role to play. They are responsible for providing that strong framework, that strong structure that enables clinical personnel to perform their services effectively. Definitely, doctors, nurses, paramedical staff, they are not going to take care of management and operations, right? Someone needs to take care of these things. Supplies should be available in adequate quantity, people should be available, and the services should be high standard. All these things are taken care of by hospital managers. That's how much important the role of hospital management and hospital manager is. Okay. So never undermine the role of management people. It's very much important. Now, who should go for it? See, whenever a person opts for bio in 12th standard, usually they want to become a doctor or nurse or paramedical professional. After a certain point of time, as they move higher up in the ladder, they will start feeling that now they need to have management skills because they will be no more individual contributor, right? They will have to supervise a team of junior people. At this stage, people may want to go for a few management related certifications or courses to develop that aptitude, to have that understanding, so that they are able to lead a team. Also, some people, they might feel like switching from clinical to management. These people can also go for a hospital management course. Also, sometimes people are not able to pursue what they wanted, but there is a deep desire to serve healthcare industry. These people also can go for hospital and healthcare management courses. Okay, it will help them in working in healthcare sector and serve the healthcare department. So that was uh, a brief introduction to who and who should not go for this course, and what is the role of hospital manager and what is the role of hospital management in a hospital. Now, let's go through the theoretical part. The key concepts, as mentioned earlier, healthcare management encompasses planning, organizing, directing, and controlling of healthcare resources to achieve organizational goals. Now, what are organizational goals? It depends. If it is a private hospital for profit making, the goals will be different. If it is a public hospital, the goals will be different. If it is a hybrid organization, if it is a charitable research organization, goals will be different. So the organizational goals completely depend on the nature, size, and complexity of the organization. Fine. It involves managing personnel, finances, facilities, information systems to optimize patient care and ensure operational effectiveness. So that's what we discussed just now. Okay. The scope of healthcare management extends across various settings, including hospitals, clinics, nursing homes, home healthcare agencies, and public health organization. Fine. Now let's talk about scope and objectives. The primary objective of healthcare management is to provide high quality patient care, maintain operational efficiency, comply with regulations and accreditation standards, ensure financial sustainability, and address ethical considerations. Healthcare managers play a vital role in achieving these goals by leading and coordinating diverse team of healthcare professionals, managing resources effectively and adapting to ever-changing industry trends. Now, what are these ever-changing industry trends? So you must have heard about NABH guidelines, NABL guidelines, ISO certification standards, JCI guidelines. These are guidelines prepared by accreditation bodies. These have been devised in such a manner that if implemented, automatically that organization will be considered as a quality organization because it is complying with the prescribed standards. Fine. So hospital managers are responsible for, first of all, understanding these guidelines and then implementing it in their organization. Okay. Also, they need to know about all applicable rules, regulations in their area, the government guidelines, government issued guidelines, accreditation guidelines, certification guidelines, necessary licensure requirements, everything. They need to know everything because only when they will know about what is supposed to be done, what is the government requirement, what is the requirement of accreditation bodies, only then they will be able to do something about it, right? So not only the general management and operations, hospital managers are also responsible for these technical things. Fine. What are ever changing trends? We were discussing that. So be it accreditation body or certification body, they keep revising their standards. So I request all of you to visit NABH and JCI website. Recently, they have revised their guidelines. Now we have 6th edition of NABH standards and 7th, 8th edition of JCI standard. Similarly, government also keeps revising its laws and regulations. So it is the sole responsibility of hospital management to keep themselves aware of these things and implement these things in the healthcare setup. Fine. Next topic, organizational structure and workflows. So there is no hard and fast rule. The organizational hierarchy will completely depend on the nature, size, and complexity of organization. For example, in a small clinic, we will not have this kind of hierarchy. Okay, this is something that is applicable in medical college, in large scale hospitals. A medical college will have board of directors. Under board of directors, there will be a CEO. Then under CEO, there will be departmental heads. Departmental heads include both clinical and non-clinical heads. Under departmental heads, we'll have supervisors and managers. And under supervisors and managers, there will be healthcare professionals. And healthcare professionals are both medical and paramedical professionals. So, in the beginning, in the initial stage, you may get appointed as a supervisor or manager after doing hospital management course. Okay, so hospital or healthcare organizations, they have to adopt a hierarchical structure with a defined chain of command. At the top, board of directors, they are responsible for setting strategic direction. CEO oversees daily operations. Departments such as medical, nursing, finance, and human resource are managed by departmental heads who report to CEO. Supervisors and managers supervise team of healthcare professionals, ensuring efficient workflows and adherence to policies. This structure ensures effective coordination and communication, ultimately contributing to patient care quality. So, like startup or IT setup, healthcare organizations cannot afford to have a flat structure. Healthcare organizations need to have a definite hierarchy that needs to be followed strictly so as to ensure efficient and effective operations. Next topic, roles and responsibilities of healthcare managers. The primary responsibility is to ensure that the healthcare organization is able to provide quality services. Let's talk about other responsibilities, planning and budgeting. Healthcare managers develop and implement strategic plans, set budgets, and manage financial resources to ensure the sustainability and growth of organization. Number two, staffing and human resource management. They are also responsible for assisting HR department in recruitment, hiring, training, and evaluating healthcare professionals. Number three, quality assurance and improvement. Managers are responsible for monitoring and improving the quality of care delivered to the patients. This can be done with the help of key performance indicators that can be monitored on a regular basis. And finally, compliance and accreditation. They ensure compliance with relevant healthcare regulations, accreditation requirement, ethical standards, safeguarding patient safety, and organization's reputation. Coming to healthcare regulations, accreditation, and compliance, these are a few guidelines. So NABH, NABL, ISO, I have already mentioned. Few other guidelines are HIPAA, Joint Commission, and CMS regulations. Let's talk about them individually. HIPAA, because we are living in a digital world, okay, especially post COVID, the digital world has gained a lot of importance. Telemedicine, the concept of online consultation, ordering the drugs online, and ordering lab test online, all these things have gained a lot of momentum. Okay, so when this happens, when you are opting, for example, let's consider an app, 1mg. There are several apps, 1mg, PharmEasy, NetMeds, and several apps. You opted for online consultation. Definitely, you will be sharing some personal information when you are doing that online consultation with the doctor. Doctor will prepare a prescription and share it with you over app. And after that, you may order for lab test or you may order medicine. Lot of information getting shared in this process. All these things need to be protected in a proper manner. These medical details, medical information, these are all considered as sensitive information. So to protect the information, we have an act, HIPAA, the Health Insurance Portability and Accountability Act, which protects patient health information by establishing national standards for protecting sensitive medical data. Next, Joint Commission. The Joint Commission is a non-profit organization that accredits healthcare organizations, setting standards for patient safety, quality of care, and operational efficiency. This is an international organization. NABH and NABL, ISO, these are more accepted in India. However, some good brand hospitals, they sometimes go for dual accreditation as well, and they have both NABH and JCI accreditation. Okay. Last, CMS regulation. The Centers for Medicare and Medicaid Services sets regulation for healthcare providers participating in Medicare and Medicaid program, ensuring patient access to affordable and quality care. So this is something related to insurance. Next slide, challenges and emerging trends in healthcare management. So let's discuss about the major challenges, technology integration. So traditionally, the healthcare organizations, they were not that tech savvy, technology was not a part of it. But now people have started using machines, equipments, automated systems, software, websites. So as healthcare manager, you can also not remain rigid or stubborn that I am not going to go for technology. I want to operate in a traditional way. You need to be open. You need to be open to ideas. Okay. If anything is happening, if any new model, any new software, or anything new has arrived in the market that may ease your operations, that may make your operations more efficient and more effective, you should go for it. Second challenge is population health management. So India is a developing country and we have limited resources and we have very high population. So the limited resources need to be used very cautiously. In such cases, you need to pay a lot of attention to promotive and preventive aspects of healthcare. When a disease has already happened, the damage has happened, and you need to invest something, some resources to cure that disease, to provide that curative treatment or therapeutic treatment. Instead of that, if you educate the patients and the community in a proper way on how to prevent diseases in the first place, a lot of burden can be reduced on the existing healthcare resources that we have. So this is also taken care by Public Health Management Department and somehow connected directly or indirectly to Hospital Management Department. Financial sustainability. Healthcare organizations grapple with managing financial resources effectively amid rising healthcare costs, insurance reimbursement challenges, and the need to invest in technological advancement. So, no organization can function without proper flow of cash. Hospital managers are also responsible for assisting finance department in fundraising activities, making investment related decisions, encouraging investors to invest in their organization, getting loan from bank or government bodies. Hospital managers have a role to play over here as well. And once they have been given a certain amount of resources, it is the responsibility of hospital managers to allocate them very cautiously. Okay. Last point, patient engagement and satisfaction. Hospital managers are responsible for interacting with patients, not directly also, and sometimes indirectly also. They are responsible for taking feedback from the patient. Doesn't matter patient is OPD, IPD, I mean outpatient or inpatient. You need to take feedback from patient and all the relevant key stakeholders. And after taking that feedback form, hospital managers are responsible for reviewing the feedback, complaints, opinions, suggestions that patients have given and revising the existing processes continuously to make them better. Okay, so these are some major challenges and emerging trends in healthcare sector. Now coming to the expanding horizon of healthcare management career, the most interesting slide, diverse industries. So as mentioned earlier, healthcare managers are no more limited to hospital industry. Now you can get recruited as healthcare manager in any industry, including manufacturing, docks, mines, textiles, and more. Number two, it is recession proof. Healthcare management offers a comparatively stable career path as it is largely recession proof, providing growth opportunities even during challenging economic times. COVID period is an excellent example. Okay. Point number three, global opportunities from local communities and rural areas to high-end hospitals in developed nations. Healthcare managers play a crucial role in ensuring operational efficiency and quality care across diverse settings. So if you, just a second, Sonam. So if you have opted for hospital or healthcare management course, you need not worry about your job. Healthcare facilities are everywhere. They are omnipotent. Okay, they are not concentrated in any particular region, be it rural area or a developed nation. You will find healthcare related opportunities everywhere. It is not limited to any particular geographic location. Okay, so Sonam, we can start the quiz.
Okay, okay, ma'am. So I'm going to shoot the quiz, and I request to all of you to participate in this quiz.
Requesting all the participants to fill this quiz, submit this quiz. Akshay, Amit, Ankur, Dr. Samiksha, Dr. Shazli, Dr. Ketki, Khushbu, Dr. Mehra, Shanvi, Shashikant, Saida.
Okay, so far 25% of you have attend the quiz. I would request you all to participate in this. I'll wait just for one more minute, and we will start the session again then. This is just for your exercise only, so that you will get to know like if you aware about these things or not. And you can also have queries, then you can ask at the end of this session. So kindly participate and resolve your queries. Okay, so 50% of you have attended the quiz. I can understand that it takes time to read out the question and select the answer. This is perfectly fine, but we don't have much time, so I would like to move ahead with the session. And I'll do one thing, I'll be sharing with you QR code of this quiz, particular quiz in the chat box that so that you can attend this quiz, post this workshop as well by downloading that or by copy that. Okay. So don't worry. So I'm going to end this here. Thank you so much for participating. Ma'am, thank you so much. And you can start now.
Okay, thank you, Sonam. So, we were talking about patient safety. So, what is the benefit of doing so much of hard work? We have talked a lot about the problems we are having in healthcare sector, the possible solutions, the things hospital managers do. But what is the point? Number one, to ensure operational efficiency and effectiveness, and the most important thing, patient safety. So doesn't matter what kind of standards, which standard you are following, or whether you are accredited or not. If any third party comes to your organization and audits it for compliance purposes, the first thing that party is going to see is how good patient safety initiatives are. Okay, this is something where auditors do not compromise. Patient safety is of utmost importance, and with the help of strong hospital management system, you can ensure patient safety, enhance patient satisfaction, and adhere to ethical practices. So let's talk about individual points. Patient safety. Healthcare managers are at the forefront of patient safety initiatives, implementing policies, procedures, and technologies to prevent medical errors and ensure a safe environment for patients. For example, hospital infection control procedures, safety manual, implementation of procedures mentioned in the safety manual, code red, violet, and so many other contingency code implementation of those codes. Point number two, patient satisfaction. They prioritize patient satisfaction by fostering a positive patient experience, promoting clear communication, and addressing patient concerns and feedback. So, because they engage with community, they are able to understand their problem and solve it in a proper manner. Because only when you know the problem, you will be able to do something about it, right? And that's what hospital managers do. Ethical practices, healthcare managers adhere to ethical principles in their decision making, ensuring that patient care is delivered with integrity, respect, and confidentiality. So, there are code of ethics for medical professionals, for nursing staff, for paramedical professionals. So this is a small homework for all of you. Do a little bit of research on this topic, code of ethics. Okay. Hospital managers are very well aware of code of ethics. They impart training sessions on these topics to doctors, nurses, and everyone working in the organization, and make sure that everyone is adhering to the ethical guidelines applicable in that area. Moving on to the next slide. Now, key takeaways and next steps. In conclusion, healthcare management is a dynamic yet rewarding field, demanding skilled professionals who are passionate about improving healthcare delivery. By understanding key concepts, organizational structures, emerging trends, and career opportunities, you can definitely embark on a fulfilling career in this essential industry. Always remember, continuous learning and professional development are crucial to staying abreast of the latest innovations and challenges in healthcare management. Seek opportunities to network with industry professionals, participate in professional organizational events, and pursue advanced education to advance your career and contribute to the betterment of healthcare systems. So, above all, you will get that sense when you will serve healthcare sector, you will get that satisfaction that you are doing something for the betterment of the community. Okay. And last, we have a short course name is certificate in health and safety. The mode of learning is self-paced. Original fees mentioned on the slide, duration 12 weeks. So if you are not very much confident about whether to go for advanced level certifications or not, you can start with this short course and you will be able to get a feel of the subject, whether it is for you or not, whether you are really interested working in these kind of areas on these kind of things or not. Okay, you will get that kind of idea. So as an introductory offer, ASIC Learn has offered a discount to the participants. It is mentioned on the slide. You can copy this coupon code. And Sonam, I request you to present that link and
Sure, sure, ma'am. Sure, ma'am. So I would like to present my screen first. Is my screen visible?
yes, it's visible.
Okay. I'm also simultaneously putting the link in the chat box for all of you. You can go to this and access this course. And do not miss, because this offer just for 48 hours. We don't want you to miss it. This is the name certificate in health and safety, which is self-paced. As I told you, Isaac is famous for flexible learning, where you no need to take extra time, all curriculum already designed for you. Okay, as you all mostly people who joined us are working, right? So this is convenient for you. This is the objective, what you will learn in this course, what skills you will gain through this. These all are the curriculum we have set for you. You can click and see, right? And if you want any assistance, these all are the FAQs. We also provide placement assistance from our Rozgar Mantra portal, which is like Naukri.com portal. We do have our own portal called Rozgar Mantra. Okay, so this is about the course. Here you can see the right hand side. This is the enroll now button. But just click on this button and you will start your enrollment process. Like I clicked here, and you need to just apply coupon code here, which is CH. One moment. Okay, here it is, CHS20. Just copy, you can write it down anywhere on your copy or notes, and click on the link I have shared on the chat and apply here. Like, and when you click on apply and check out, there will be basic details of your like name, contact number, address, and you will give it to go for to buy the course. So this is the thing about this course. Let's move back to the slide. Now you can ask your queries regarding the course and things that Gariba ma'am has take you through. One more thing I'm going to add here. I'm going to put one more link, which is feedback form link. I would request you all to fill this form so that we will get to know your interest and your like views on this workshop, so that further we will implement this and to make it more convenient for our audience. So please do that. Without doing this, kindly do not leave the meeting. Okay. Yeah, that's it, ma'am. You can go ahead.
So Shashikant ji, he has raised his hand. I believe he wants to ask something.
Shashikant ji, you can talk now. You can. I have made you unmute. Yeah, you can now
Okay,
speak.
so his question is, I am an MIS service provider to hospitals. Can we connect for a commercial? I'm sorry, I will not be able to answer this. Sonam, can you take this up?
Sure. So as you have already dropped your contact number, I'll be connecting with you for this thing. Okay. So you need to wait for some time for that. So if you have any question regarding the workshop, what we have learned so far, and regarding the course that I've take you through. Any questions from anyone?
I request all the participants to unmute themselves. You can switch on your camera. You can unmute yourself, or if you are not comfortable talking, you can just drop your doubts in the chat box. I'll be more than happy to answer all your queries.
Akshay, Amit, Shazil, any query, any question? Or if not, then you can write in the chat box so that we can move ahead and wrap up the session for today. And please make sure to fill the feedback form.
So, also please let us know what kind of course are you all looking for? Just certificate course, diploma course, basic diploma, advanced diploma, undergraduate, postgraduate? What kind of courses are you looking for? Please let us know.
Yeah, that I have included in the feedback form, ma'am. So if
Okay, okay.
yeah, yeah, we'll get. So far, I just got one response. Can we, if you are filling up the form and it's taking time, then you can you can give thumbs up or any of the thing you can write in the chat box that you're doing this so that we can wait for you. Okay, so we will wait till 5:30 to fill you all feedback form. Okay. 2 more minutes are there. Is there any issue with the Google form or feedback form? You can write, please. Or if you done with the feedback form, you can write in the chat box or you can give a thumbs up. Thank you so much, Dr. Satyendra. I'm waiting for others' response. Akshay Mane, Amit, Noble Mara, have you done with the feedback form? Or if you are facing any issue, kindly write in the chat box. And please do not forget to write this coupon code. This will valid for 48 hours and it will help you to get 20% discount for this such a wonderful certificate in health and safety course. So do not miss this out. Write this somewhere with you. Okay, Noble Marat, you're filling the form. Okay. I'll wait 1 more minute for you.
So there are ample amount of opportunities, Dr. Samiksha. Just visit any job portal. You will find so many jobs. Even in public health sector, government has also started recruiting healthcare managers and hospital managers. Okay. So I think you will have to coordinate with Sonam for this thing. You are already working as assistant professor and you want some help for your students.
Okay, so Dr. Samiksha, I would like to like your contact number so that we can connect and discuss the same on call because as we are running out of time. Yeah, thank you so much. We will definitely connect with you. I hope you all have filled the form. If not, kindly copy the link. I'm again posting it. Copy it, and whenever you get time, do this because it's just for you. We want your interest for future reference so that we can come up with more workshops like this and resolve your queries and help you to grow in your career and the things that you are seeking for in your career. So yeah, that's it from my end. Thank you so much, Karima ma'am. That's a lovely, fruitful session for your end. And yeah, that's it. Have a good day ahead to all of you.
Thank you, Sonam, and thank you to all the participants for attending the session.
Thank you. Good day.
Okay, good day.